All right, so here we have our heart, which I've drawn as a box, just for simplicity's purposes. So this is our right atrium, right ventricle, and left ventricle. And over here, I have lungs. And over here, I have everything else. And this is, let's name him Gene. Hi, Gene. Okay, so we're gonna start coming back from the systemic circuit. So oxygen poor blood coming from Gene's veins back to the heart. And I'm drawing this non-accurately, I wanna stress that. So I'm gonna make it appear as though the superior and inferior vena cava are coming from Gene's head. That couldn't be further from the truth, just so you know. And so this is just to show you where the blood that's coming into the right atrium is coming from. So this is superior vena cava and inferior vena cava. So this is taking oxygen poor blood into the right atrium. And then it passes from the right atrium down into the right ventricle. And to get there, it passes through a valve. And I'm going to draw the same valve on the other side. So I'm going to, in order to kind of keep this middle area free of clutter, I'm going to footnote this 1 and 2. So 1 is tricuspid valve, which for some reason I did not put a space in. So let's try that again. Sometimes it's really hard to talk and write at the same time. Okay, and then on the left side, we have the mitral valve, which is also called the bicuspid. So I'm gonna just do some quote marks for the same thing. So this valve is pesky because it has a bunch of names, bummer. Okay, so from the right ventricle, blood is squeezed through another valve. Let's pick a different color for this. Actually, how about light blue, since at this point the blood is still oxygen poor. So this is the pulmonary semilunar valve. So from the pulmonary semilunar valve, we enter the pulmonary trunk and then the pulmonary arteries. I am not drawing both of them, but there are 2, 1 on each side.
I know I'm being recorded, but can I ask you a quick question?
Absolutely.
And it's totally fine if you record me.
Okay, thank you.
So the semilunar valve is another name for the pulmonary valve and the aortic valve?
Correct. So semilunar refers to the shape of the valve cusps, and then pulmonary versus aortic refers to which valve, which vessel that valve is the entrance to.
Okay.
Good question. Okay, so we still have oxygen poor blood. So the whole purpose is to go over to the lungs to get some oxygen, because the lungs are our oxygen harvesting apparatus. So after that occurs, we have from the lungs pulmonary veins. There's 2 pulmonary veins on each side, but I'm not drawing them that way because I want to keep this drawing relatively clutter-free, although it's getting pretty messy already. So why is this a vein? It's not blue. Well, veins are any vessel that carries blood back towards the heart. So vein does not actually refer to whether a vessel is oxygen poor or oxygen rich, but rather just the direction of blood going through it. So anything that's a vein is carrying blood towards the heart. Anything that's an artery is carrying blood away from the heart, which is why the pulmonary arteries are colored blue. Which brings me to an important point. The systemic circuit and the pulmonary circuits are associated with the right side of the heart and the left side of the heart, respectively. So let me find my highlighter here. There we go. The pulmonary circuit is the circuit of blood between the heart and the lungs. So, nope, I want a much bigger dot. There we go. So it's that. So basically, most textbooks say that it starts at the right side, and that's because starting from when this oxygen poor blood enters the heart, then it's between the heart and the lungs, and then back to the heart. So after that, we've got blood, oops. Thank goodness for undo button. There we go. So blood's gonna go through the mitral valve and then out. And now I've run out of room. So we have a conundrum here. So I'm gonna have to loop this around. So I think I'm gonna erase these for now. Without getting too close to my pink blob, because I need that. And then I'm gonna make an aorta for myself. Now, obviously the aorta's position in this drawing is not accurate, so don't take this drawing to be an anatomical truth. Let's just put it that way. It's a schematic diagram. And that means that this sucker right here is the aortic semilunar valve. So the aorta is going to carry oxygen-rich blood, and then it's going to branch, and it's going to supply all of Jean's organs and tissues with oxygen-rich blood. And then from those capillary beds, venous blood is going to return to the right side of the heart. So let's pick another color. I'm going to go with this maroonish purple. So I'm coloring Jean purple to indicate that all of the capillary beds in all of Jean's organs and tissues are part of the systemic circuit, as are these vessels here. So systemic circuit is between the peripheral organs and tissues and the heart. Oops, I lost a highlight. Let's put that back. Perfect. And then pulmonary circuit is between the heart and the lungs and is highlighted in pink. So that is the path of blood through the heart and through all the things on the way and in between.